Hello everyone, this is Challenging Topics on the Bone and the Skeletal Tissue, Chapter 6 of the Mariam textbook. So first of all, we just need to quickly recap about cartilage because cartilage plays a big role with the skeletal system, right? So cartilage is the only connective tissue that does not have its own blood supply. It depends on the perichondrium which surrounds it for its nutritional needs. So we have three types: the hyaline, which is the most abundant and most found in most places, with the exception of 5 places. So where the elastic and fibrocartilages are found. Elastic is found in the external ear, the ear pinna, and the epiglottis, while the fibrocartilage is found in 3 places: meniscus or menisci plural of the knee, intervertebral discs, that's between our vertebral bodies, and pubic symphysis or symphysis pubis, between the pubic bones. In terms of bone shapes, we classify our bones into 4 groups: long bones, or longer than widthwise, humerus, femur, even our metacarpals, phalanges, tibia, fibula, radius, ulna, all come under this. Next is irregular shaped. As the name suggests, the bone is very irregularly shaped. It is the two good examples are vertebrae and os coxae, the pelvic bone. Next one is our flat bones. Our cranial bones as well as our sternum are both classified as flat. Then the last one is short. So as the name suggests, the length is not very long. It is short. A wrist and the ankle bones, so carpals and tarsal bones, are within this group. In terms of bony texture, we have two histological variations. It's going to be the compact bone and then spongy bone. This image is a beautiful example of skull. So you'll see compact bone on the external of the skull, so internal of the cranium, and then in the middle is going to be our spongy bone, so compact bone and spongy bone. Okay, so compact bone is dense, mostly found in outer portions of the bone, and then spongy more deeper in, and it got the honeycomb appearance. The compact bone's subunit is called the osteon, which we'll go over in the next slide, and for the trabeculae, trabeculae will be the subunit for spongy bone. They're flat pieces of bone. So prior to looking at the compact bone, let's look at long bone structure. So the shaft of long bones is called diaphysis, and then the ends, the widened out ends, are called epiphysis. Between these two we have metaphysis, and this is where we would have had the growth plate. Once it fuses, the cartilage disappears, it ossifies, it becomes bone. It's going to be called epiphyseal line. Okay, once we reach the age of 21, all our epiphyseal plate had fused, and all we see is epiphyseal line. Then we have periosteum that surrounds the bone. It is connective tissue that contains a lot of blood vessels as well as osteogenic, so stem cells of bone. Within the diaphysis, the shaft of the long bone, we have a medullary cavity. So within the cavity in adults, we have yellow bone marrow. Lining the cavity is called endosteum. So the endosteum also contains osteogenic cells. So if we fracture the diaphysis, we can repair from inside out as well as outside in. Okay. Next, we're going to just quickly talk about red bone marrow. So red bone marrow is found within the cavity spaces of spongy bone, And in newborns, we also can find it in the medullary cavity. In adult bones, long bones have very little red bone marrow. The best place to find red bone marrow is flat cells, flat bones, as well as irregular bones. And if one of us was to donate red bone marrow, the usual place that they take it from is os coxa, a pelvic bone. In terms of the bone histology, we have the organic component of bone as well as the inorganic component. So organic component will be the cells, of course, the bone cells. We'll talk about the 4 different types of bone cells. And then osteoid, which are the collagen fibers basically, which gives the flexibility of our bones. Inorganic components would be mineral salts, calcium and phosphate, and then a compound called hydroxyapatite, which gives the bone its hardness. So let's talk about the 4 bone cells. The first one is the osteogenic cell. That is the stem cell. Okay, that stem cell that has the capabilities to divide, multiply, as well as turn into 2 others. The third one is from a different line. Okay, so we'll talk about that. So osteogenic cells can become osteoblasts. Osteoblasts, as we covered in our tissue lecture, was blast cells are immature cells. They will produce the bone matrix. In this case, osteoblasts will produce bone matrix. Then the third cell that also arises from the osteogenic cell is the osteocyte. That's the mature bone cell. It monitors the bone and then maintains. It actually dictates kind of conductor of the osteoblast to produce bone, as well as the other bone cell, the osteoclast, which reabsorb or break down bone. This actually comes from a line from the red blood cells, the monocytes. Now let's look at the compact bone. Okay, so compact bone lies just below the periosteum. We have this appearance of a tree trunk being cut, and that one of those is an osteon, the structural unit of compact bone. Okay, so in this picture there are many osteons, as you can see. Okay, so let's look at the different structures of an osteon. First of all is the lamella. Lamella are the layers that make up the osteon. So this is quarter of an osteon. So each of these circles would be a lamella. In this osteon we'll also have little cavities called lacunae. Lacunae is also found in in the cartilage, where there you'd find the chondrocyte, but here it's bone. So we find osteocytes within this cavity, within the lacunae plural, would be found osteocytes in compact bone, in bone. We also have structures called the canaliculi. They're little canals. They're basically going radially. They go from the osteocytes. Osteocytes are able to communicate with other osteocytes, as well as the center of the osteon, which is the Hervatian canal or central canal. The Hervatian canal or central canal contains blood vessels. Okay, that's why if we break, and nerves as well, that's why if we break bone, it bleeds a lot, as well as it's painful. Not just it doesn't just have blood vessels and nerves on the outside, but it has within it as well. Let me just go back. We also have perforating canals or Volkmann's canals. These connect the central canal to each other, as well as to the medullary cavity. So spongy bone, we have flat, irregular shaped, flat trabeculae that are found, that make it up. Okay, and these are mainly found in the interior portion of bones, whether it's short, flat, irregular shaped, or in the epiphysis of long bones. These spaces, which we'll talk about, are great for red bone marrow that we talked about. So let's talk about bone formation. So there's two types of bone formation: the endochondral method and the intramembranous method. If we just go over the name of it, endo means inside, chondr is in reference to cartilage. So basically we're going to form a cartilage. It's a cartilage model, and then we will convert this cartilage into bone. And the other type is intramembranous, so within membranes, within fetal membranes, or primitive membranes, we will develop bone. The endochondral method is used, hopefully you can distinguish in terms of the picture, it's actually going to be distinguished to form long bones, okay, while the intramembranous is mainly used for the other types of bones. So initially we will form a cartilage model. It's going to grow later, interstitial and apositional growth. Interstitial growth is lengthwise growth, and apositional growth is the widthwise growth. Then we will have some osteogenic cells coming, and that's when we form a bony color, which will form around what will become the diaphysis. Then within that diaphysis we'll have calcifications, and we will have primary ossification centers forming it. So calcifications will happen, and then the osteoblasts and osteoclasts will come into this area. Osteoclasts will break down this calcification, and then we'll have osteogenic cells and blood vessels coming in, which will become the primary ossification center. So primary ossification center appears in the diaphysis, and it is here that is going to start making the bone matrix itself, the bone material. Okay, and then at the same time when this is happening, when this has started to happen, we will have secondary ossification centers appearing in the epiphysis, and then the epiphysis also will ossify. Leaving this blue will be the cartilage, so we'll have what's left of the cartilage will become the articular cartilage. That's what will be used for joints, as well as this part, which is going to become the epiphyseal plate, which helps this bone to grow. Okay. Next is the intramembranous method. So we will have this primitive fibrous tissue, these membranes, within which ossification centers appear. So we'll have osteogenic cells coming and osteoblasts. They will start producing the osteoid, which will calcify, and any cells, osteoblasts, that are trapped within this osteoid become osteocytes. Okay, and this builds up. What we will have is immature spongy bone forming near what would later become the edges of the bone. And then periosteum forms there. Okay, and then in that area, compact bone will replace the spongy bone. So if you recall the picture that I just shared a little while ago with terms of the skull, you can imagine that skull was going more horizontally. If you imagine the same, that if we turn it either clockwise or anti-clockwise, you're going to have compact bones on either side with spongy bone in the middle. Sorry about the typo, it should be red bone marrow. So within these spaces, within these cavities, we will have red bone marrow developing afterwards. So let's talk about calcium homeostasis. So as we mentioned as I mentioned in one of the slides earlier, inorganic material of our bone has calcium and phosphate. So basically our bone is also like a bank for calcium. Okay, so if we have either high calcium or low calcium in our blood, that would affect how much calcium is added or removed from bone. So let's look at the first example when calcium levels are low in blood, hypocalcemia. Okay, this will trigger our parathyroid gland. Parathyroid glands are found at posterior part. There are 4 of them, 2 on either side of our thyroid gland. So these will sense the low calcium and they will relieve parathyroid hormone. Parathyroid hormone release or even the parathyroid hormone presence will stimulate a couple things. One, they're going to stimulate the cells called osteoclasts. Osteoclast will break down bone. Remember we mentioned osteoclast breaks down bone while osteoblast makes bone. So osteoclast breaking down the bone means they're going to be releasing the calcium from the bone into the blood. Okay, so here the idea is to increase the calcium in blood to a higher level, which is why you might have heard of people who suffer with bone thinning. They are recommended to increase their calcium intake, because if this could be one of the reasons why they have bone thinning, right? If they had low calcium in their blood, so it was broken down, bone was just broken down to release the calcium. PTH also stimulates our kidneys to retain, so reabsorb calcium. They actually also stimulate our small intestines to absorb calcium. All of these three, the effect is to increase calcium. We're hoping that it returns back to normal. So let's look at the other scenario. If we consumed a lot of calcium based products like a lot of milk, cheese and so on, we could have high calcium in our blood, hypercalcemia. Hypercalcemia will trigger, of course, by negative feedback, it will stop PTH from being released. It'll also trigger the thyroid gland, one cell. So the main function of our thyroid gland, of course, is to produce thyroxine, T3, T4, but the thyroid gland also produces another hormone. This hormone is called calcitonin, and we'll also cover this in chapter 15. These cells which produce calcitonin are surrounding the follicles which produce the thyroxine, so these are parafollicular cells will release calcitonin. What calcitonin does is kind of the opposite of what PTH did. So here it's going to inhibit our osteoclast. It also will promote osteoblasts, which will cause calcium to be deposited in bone. They don't do much on the kidneys. They just prevent calcium reabsorption or stimulation in our intestines to absorb calcium. They do not have that stimulus on kidneys and on our small intestines. So when osteoblasts are stimulated by calcitonin, calcium will be deposited into bone. So now you're removing the calcium from blood and you're putting it into the bank, right? So calcium in the blood will decrease, hopefully returning it back to a normal level. So osteoporosis, has many different causes, but one of the leading cause is menopause, right? A quick drop in estrogen levels has the highest risk factor for developing osteoporosis. So hence we see many postmenopausal women who suffer with osteoporosis or who suffer with them. So let's talk about fractures next. So bone fractures are basically breaks in bone. Usually in the young youth, it's trauma that causes it, while as we age in the elderly, the main cause is osteoporosis. So let's talk about treatment options. So the treatment involves reduction, right? So you want to align those two broken pieces and let the bone heal. We have open reduction, which means we surgically open up the wound and try and fix the two ends of the bone together so they will heal. So we can use surgical pins, wires, plates, and so on. Close reduction is when we try and manipulate the part of the body and make sure that it aligns, and then of course we will immobilize, right? We can use cast or traction. Traction mostly are used for the leg. This again helps for the healing to take place naturally by our own body. So let's talk about fracture repair. There's 4 stages of fracture repair. The first phase is hematoma formation. Oma means swelling, hemat is in reference to blood. Basically, as we mentioned earlier, bone is highly vascularized, so if there's a fracture, we're going to bleed a lot, and this blood will eventually clot, forming a hematoma. Okay. Later, we will have this hematoma being broken down. What we're going to do is produce fibers. We try and connect this, and then form cartilage as well. We just like when we form the bone, we use cartilage. When we are healing bones, broken bone also, we generally, for long bones especially, we use cartilage, right? So once we have these fibers and cartilage, we call it fibrocartilaginous callus. Okay, if you think a callus, a little bump, right, on your if you if we did gardening or any sort of manual labor work, or even use especially free weights, you can get callus on your hands, right? So it's a little bump which connects these two fractured parts together. Next, we will replace that bone, that cartilage, with bone. But here it's easier to build spongy bone, so we will first replace it by spongy bone. Okay, and then we form a bony callus. Okay, we don't stop there. Just because we've connected it with bone, we don't stop there. What we want to try and do is return it back to its original shape. So wherever there was compact bone, we're going to put compact bone. Okay, wherever there was a cavity, we're going to put a cavity in. Okay, so the bone undergoes remodeling, reshaping to try and return it back to its original shape. What you will see is it's actually thicker in this region than when it was prior to the fracture. Okay, that's usually, sometimes it's there for years, depending on the bone, how much stress it undergoes and how much remodeling it undergoes. Sometimes it can be there for years after the fracture's healed. Usually we want to get to or close to the bony callus before we start thinking about removing the immobilization, right? Ideally we want to get here. Usually it takes about 6 to 8 weeks to get here. Next, I just wanted to mention, I mentioned earlier, osteoporosis is when we have reabsorption, the rate of reabsorption higher than the rate of deposition, right? The matrix is normal, but the bone mass declines. Okay, the two places where this is most susceptible is our spine, the vertebrae, the body of the vertebrae, and the neck of femur. Okay, so these fractures are very common in osteoporosis. Here's a picture showing that this would be normal. This is the normal honeycomb appearance of spongy bone, but here there's many more gaps in this bone tissue, right? So that's our quick recap of concepts of chapter 6, bone. Have a great day, and I will catch you in another video.